So now we might talk about what happens when we consider the potential for health services to change by making central the creative arts. And to do that, I'd really like to welcome my colleague, Dr. Michael Hodgins, who will talk about using art to navigate complexity and to foster resilience within the health services. Thank you so much, Michael.
Thanks so much, Claire. I'm so privileged to be here today and to be talking about art and navigating complexity in health services. And I'm very privileged to follow the tough act to follow that was Katrina. It was such a beautiful presentation and really shares many of the points that I'd like to make in my talk today. So yes, I'm Michael Hodgins. I'm a research associate with the Population Child Health Research Group, School of Women's and Children's Health, UNSW. And I'd like to talk a little bit about how we might think about using art to navigate complexity and foster resilience in health services. Also like to acknowledge many of the images I'm using today in my presentation are by Michelle Jersky, who you've just heard from. So, my story, who am I? I've been a health researcher for 8 years. And I started my health research journey, luckily, by thinking very deeply about arts in health research. I worked on a project with, I know Catherine Boydell's here today, worked on a project led by Catherine Boydell, interviewing 36 artists and researchers doing arts-based health research across Canada, engaging in multiple art mediums and health areas in arts-based research, using art to create and represent research knowledge. And much of the things I'm going to talk about today stem from that project and that wonderful experience to think about how art can shape health and be involved in the research process. But since that project, I've gone on to think more deeply about how we might change and explore health systems, how we can improve health across diverse areas, including palliative care and child health. And I've always been informed by my experience looking at arts-based health research and thought about, well, how can we bring art into health systems change? So for a long time, we've thought about health system change and using research to shape health systems in a very linear way. We kind of see, or we've reduced health system change to funding being put into the end of one pipeline. When we identify what those funding priorities are, we can pour, how many millions of dollars into that pipeline. And through the magic of clinical trials and metasynthesis and systematic reviews, we can produce optimal guidelines for evidence that can be transferred to any context, and then poured quite neatly into clinicians' heads to inform their practice and make sure they produce good healthcare. But we know very well now that this is a flawed model because of its reductivity and simplicity. And the reality is that health is inherently complex. We might think about pouring that research dollars and that funding, into the pipeline, but at the end of that pipeline, we have competing needs, competing priorities, diverse patients. We now know that health is multidimensional. It's not just about biology or genetics. It's about where you're from, your place, your context. And on top of all that, we're dealing currently with a global pandemic, altering the way we think about and deliver care. A tension between what's the best evidence from a transferable perspective and good care at the coalface. So thinking about what does the person in front of me need. Chronic illness necessitating change in how we think about healthcare. So it's no longer the model of becoming sick, going to get treatment and becoming better, but living with illness, and managing the multiple dimensions of illness that come along with that. We've often tried to bring technology and big data into health and healthcare to solve all the problems that we have, but that's often failed because of a lack of interoperability and people not engaging well with technology, and technology just changing rapidly over the course of the last 20 years and people not being able to keep up. And additionally, the tension of activity-based funding, so reframing relationships as, you know, as costs and phenomena that need to be commodified. And so what I want to think about today and think about with art as a refrain is some questions that are generated from thinking about complexity in healthcare and resilience, and how we promote resilience in healthcare. And those questions are: how do we promote patient-centered care? How do we ensure clinicians make good decisions in the face of competing evidence? How do we represent the plurality of voices with a stake in healthcare? And how can we ensure that our health system ultimately remains resilient? So the first question, how do we promote patient-centered care? Patient-centered care is now widely recognised as a foundation to safe, high-quality healthcare. It's care that's respectful of and responsive to the preferences, needs and values of individual patients. And it requires compassion, empathy, founded on emotion work. But there's still a struggle to bring patient-centered care into the clinic for a variety of reasons. I'd like to argue that making art a part of healthcare practice is one way we can promote patient-centered care, and that might be through art therapy, using art to engage patients in healthcare, and using art to co-design health services. You've already heard about Nalunanga from Katrina and Michelle, and I won't speak too much about it because Katrina did such a wonderful job of describing that experience. But I will say that unless you've been to that space, you know, being to that space and seeing how the community's health centre transforms during Nalunanga, it's a sight to behold. And Michelle and Katrina's program completely remakes that clinical space into a culturally safe, artistic space where mothers and their children have ownership and control of what's happening within those walls. And another project I'd just like to use as an example of bringing art into healthcare spaces is the Birth Project by Susan Hogan and Lisa Watts. And the Birth Project was a project that invited parents and birth workers in Northern England to use art to explore and unpack the experiences of birth. And that was used through art making, with drawing, painting, photography, photo diaries, art elicitation in a very participatory way. And these artworks were used to explore experiences of compassion fatigue, stress, birth suffering, and postnatal readjustments. And as part of this experience of bringing art into birth and into pregnancy, it increased awareness and understanding of mothers' birth experiences and helped mothers transition to motherhood with confidence and self-esteem. But for clinicians particularly, it was bringing awareness of the patient in the middle of this experience of birth and motherhood. And this medical student says a beautiful quote: "I didn't know it could be such a traumatic experience for the mother. Now I realize that they can undergo a lot of pain and not understand why, and may feel like all the hospital equipment can come between them and the bonding with their baby." And so the art making became this way to center the mother in this experience of engaging with the health service, which I think is a really beautiful evocation of what arts in health can do. So when we think about bringing arts and bringing arts in health to create patient-centeredness, we can think about how arts create new associations in clinical spaces. Patients with complex and chronic illness maybe reluctant to be defined solely as patients. So how can we modify or transform identities? Well, we can, enable patients to become the artists. We can make wards, cold clinical wards, become studios. And we can allow clinicians to reflect on healthcare in a new way through the eyes of the patients that they're seeing. And bringing arts into health, I think, enables that patient-centeredness by disrupting hierarchies and power relations, as Katrina spoke about with Nagamai. So the second question I posed was, how do we ensure clinicians make the right decision in the face of competing evidence? I spoke at the start of my presentation about the linearity of evidence to practice models in healthcare. But health systems researchers are now starting to think more about complexity, multiple voices in research evidence not merely being the result of the clinical trial, but the product of local knowledge, the product of patient voices engaging with service provider voices, engaging with community voices. And so how do we make sure all of those voices are heard and clinicians are able to navigate and negotiate those voices when they're thinking about what's the right decision for this patient? So I believe that using art to represent research is one way that we might think about responding to that question. And that might be through research-based artworks, exhibitions and performances, creating a dialogue and disseminating research results via creative approaches. And all three of those modes are different ways we can represent research and engage participants, from didactic models to dialogic models to abstract and interpretive models, allowing multiplicity and multiple responses to clinical questions. So one example of using art to represent research knowledge was part of the Pan-Canadian arts-based health research study that I worked on was After the Crash. And After the Crash was a play developed through collaboration between health researchers and actors. And the creation of the play followed focus groups with brain injury survivors, their family members, healthcare providers, to learn about their experiences with brain injury. And artists, including playwrights, actors, and directors, worked alongside researchers to develop a script based on the information gathered from focus groups. And the play was designed with an emphasis on engaging healthcare providers in professional development with regard to traumatic brain injury, thinking about the complexity of the traumatic brain injury survivors that were in front of them. And I really loved the quote from one of the artists involved in After the Crash, which was, "We understand that the power comes from both the visual, the physicality, and the researchers and artists working together to try and tune into those mechanisms in particular ways to bring more power to the message." And I think that kind of alludes to how mechanisms of art can be used to shape research messages and communicate empathy and different modalities of evidence and research. Another example of using art to represent research was an exhibition called Perceptions of Promise, which was an exhibition of visual artworks developed following collaboration between scientists and artists and social commentators, exploring some of the scientific concerns around biotechnology and the role that art and pop culture play in public debate about controversial scientific achievements. And artworks created for the exhibition included pieces that used computed tomography, scans to create sculptures of bodies, and photographs of preserved moths with logos tattooed on their wings. And it was artworks that posed questions and disrupted hegemonies of knowledge within those spaces to ask, what's happening here? Why is it happening? And is it ethical? Is it moral? And one of the researchers involved in that project stated, in our projects, we were trying to create a space for discussion. And this special role that art has, it has an immediate impact. It adds layers of impact on the viewer, which perhaps an essay doesn't have. And I think that's a really beautiful summation of that art, using that kind of art to represent research knowledge. So, of research using art, I believe that it provides value because it represents the whole arrangement of health and clinical care, the complexities of humanity, emotion, physicality, materials, that I believe art has the power to do. As with perceptions of promise, it creates space for debate and competing and multiple voices. It questions what counts as evidence and problematizes what counts as evidence, and brings things like empathy and emotion and sensory aspects into a conversation of evidence. And quite simply, it increases accessibility and engagement to research. The third question I posed at the start of my presentation was how to represent the plurality of voices with a stake in healthcare. So different voices are obviously necessary for improving health, not just service providers, but also service users, and particularly service users that are underrepresented and marginalized. How do we empower and bring those voices into the conversation to ensure that they have a say in the kinds of healthcare they receive? You might be seeing a pattern in my presentation now, but I believe art is an amazing way to create new knowledge with patients and carers and bring marginalized and diverse voices into the conversation about health service improvement. Art can be used to collect different kinds of data, emotional, sensory data, often in conjunction with other traditional data collection methods like interviews, focus groups, or ethnographic research. And art making in the research process creates space for participants to safely control the expression of their perspective, and enables marginalized groups to come in to the research process and control how they engage and what they provide in that conversation. One example of using art in the research process is body mapping. Body mapping involves research participants tracing life-size images of their bodies onto large cloths or piece of paper, using paint and other materials to map experiences within their bodies. And these experiences might be about emotion, they might be about mental illness, vulnerability, or trauma. And the centrality of the body in these processes represents how important acknowledging embodied and sensory experiences is in healthcare. And often those embodied and sensory experiences aren't well included in health research. And so body mapping is one way to bring the body into conversation and research. Another method is Photovoice. And in Photovoice, participants are given a camera, given a camera and asked to take pictures representing their everyday life. They engage in intentional dialogue, reflect on images, and talk about and share their pictures and stories to inform research, policy making, and community-based issues identified. And I think one of the beautiful things about Photovoice is it's consistently been used as an important vehicle for the empowerment of a range of vulnerable groups, showing the experience of homelessness, for example, the experience of autism spectrum disorder. And Photovoice enables capturing place, space, materials, the physicality of being. So it situates healthcare recipients in the real world and demonstrates their lived experience. It's not just within the hospital or not just within the clinic, but what's going on external to the clinic, which is important to how they receive healthcare. So ultimately, one of the benefits of bringing multiple voices using art into research and into healthcare is its ability to demonstrate and communicate non-verbal experience, emotion, sensory experience, embodied experience, invert or problematize taken for granted relationships in research, rather than sitting down with a one-on-one interview with a boring old researcher like myself. Participants can co-create, can control, can make and lead the research where they think it should go. And often this is a messy and fuzzy process, which really communicates the messiness and the complexity of healthcare and health in general. So finally, and this is, I guess, a parting question and a parting comment, how can we ensure our health system remains resilient? Again, bringing art and science in productive proximity in all the different modes of health and healthcare, from research, from translating and disseminating research to the actual physical clinical spaces, I think it will help us rethink and remake biomedical spaces into resilient spaces of humanity and care, as long as we, as a caveat to that, manage tensions between art and science, the multiplicity of meaning versus the single generalizable truths that we think of when we think of clinical research. And to do that, we have to think about disrupting the academic hegemony, the linear pipeline that I showed at the start. How can we change how we deliver dollars into health system and healthcare improvement? I don't really have an answer to that question, and that's, I guess, a question for the wider conversation. But given the pandemic, we now currently have the opportunity to remake health services with some of the principles that I've shared in mind. And finally, to let you know that I'm continuing to think about these things. This is some of the work that I'm involved in, looking at how arts-based research methodologies bring young people with complex psychosocial needs into the conversation, led by Sally Nathan, thinking about how arts-based programs improve access to healthcare, improve health and well-being for children and their families, and thinking about how we can use creative methods in co-design with young people with chronic conditions. Thank you to Population Child Health Research Team, Michelle Jersky, Catherine Boydell, the TACI Group and Arts and Health Network for having me. It was lovely to present. Thank you.
And thank you so much, Michael, with giving us so many ways to think about those complex issues today.